I wanted to quickly go over green tea as a flavonoid case study. Green tea is rich in a variety of flavonoids, particularly the catechins or catechins. These compounds can kind of polymerize and form tannins. The difference between black tea and green tea is that green tea is lightly steamed to prevent the complex formation of tannins. So it's higher in lower molecular weight catechins. So tremendous population-based studies showing health benefits, reduced rates of heart disease and some cancers. Effective dose is a minimum of 3 cups per day. And really, in some studies, 6 cups really were required to see the benefits. And we see some of the same benefits with green tea that we see with other types of flavonoids. But in particular, it has a lot of anti-cancer effects, and that's why it gets so much attention. The epidemiological studies are inconsistent. If you look at the totality of them, and one of the big reasons is many use food frequency questionnaires, and those have been proven to be very poor because people don't always recall accurately. And what we really need to know is what is the amount of green tea that's being consumed, not if they consume green tea on a daily basis or how many times a week. That's not as important as how much they're consuming. And we don't often consider genetics in flavonoid studies, but genetics do play a role. Some people are genetically predisposed to getting benefits from lower quantities of flavonoids, while others are going to require the higher dosages in order to see those benefits. And general intake may not be as important as specific subclasses or metabolites. Protective effects of green tea polyphenols are dose dependent. And this is demonstrated in a study with prostate cancer. 6 cups of green tea or 600 milligrams of green tea polyphenols dramatically improves biomarkers of prostate cancer. Lower doses, not so effective. So again, for general health, probably 150 to 300 milligrams, but for some specific challenges, we're going to need higher doses. In prostate cancer, you need 600 milligrams of green tea polyphenols per day to start seeing some improvements in the biomarkers. Cigarette smoking reduces the benefits of green tea. Look at all the population-based studies that have been done in Asia, where there's a high percentage of smokers. So cigarette smoking reduces the benefits. And if you're a smoker, you're going to need higher dosages of green tea to see a positive effect in reducing the risk of heart disease and cancer. And so this was a study looking at markers of inflammation in smokers, and the benefits were only seen at basically 600 milligrams per day. So if you're exposed to a lot of smoke, you're exposed to a lot of pro-oxidants, and you want to get the benefits from green tea or some other polyphenols, you can do a lot with diet. Don't forget that, but you may want to really pump up the supplementation. We see the same sort of dose response in weight loss. Green tea's been studied a lot in weight loss, and it works if you take a green tea extract at a high enough dose, or use an enhanced form where you get better effects. But again, to get the benefits in weight loss, you're looking at basically, it's very consistent. It's 600 milligrams. And we see all the cool effects on weight loss. This catechol-O-methyl transferase. This is an enzyme that green tea inhibits, and that leads to higher levels of fat-burning neurotransmitters. In people that have high activity of this enzyme, they don't get as much benefit from green tea. That's one of the genetic modifiers that we have to look at. This looking at total and visceral fat area. Again, higher dosages are required. High dosage, very good effects on total of fat, in particular the visceral fat. We know that the green tea catechins can stimulate lipid catabolism, breakdown of fat. It increases the activity of beta oxidation in the liver. Again, the higher doses are required. And yet you see companies marketing green tea for weight loss, and it's not feasible with the dosage that they're recommending on their label. You have to know how much to take to see the desired benefit. So this is showing inhibition of triglyceride accumulation. Again, very good results with the higher dosage. So flavonoid intake, what is an effective dose? Well, the ED95 is the dose required for desired effect in 95% of people taking a therapeutic agent. That's what we want. Based upon the population-based studies and clinical trials with flavonoid-rich extracts, there appears to be a threshold for achieving the key beneficial effects. Most of the studies with flavonoid-rich extract have used an average dose of 300 milligrams per day to show a therapeutic effect. Based on interpretation of all of this data, the total flavonoid intake to achieve an ED95 is at least 500 milligrams. I encourage an intake from a wide variety of sources for maximum benefit, okay? Again, I think supplementation is a tool, but it's not going to work as best as having a base of a flavonoid-rich diet and then using targeted flavonoid-rich extracts or specific flavonoids at a reasonable or meaningful level. Okay, so here's my flavonoid intake. Is what I try and do on a daily basis. So I'm showing you some of the things in my diet. If you go to my website, drmurray.com, it's on the slide. If you just type in flavonoid, my most recent article, it provides information to help you calculate your flavonoid intake. And it's a good exercise. You just get a general sense of what your flavonoid intake is per day. So you generally have a cup of berries. I mix it up. I don't eat the same berries every day, but I try to have at least a cup. That gives me 205 milligrams. Raw cacao powder, I generally have 3 tablespoons a day. I also take a flavanol, cocoa flavanol extract at 375. So I'm getting lots of the cocoa flavanols. I have green tea or herbal tea, just a large mug every day. And that gives me about 400 milligrams. I'm getting a lot, aren't I? And then nuts have some flavonoids, other benefits as well. And then, green leafy vegetables, other flavonoid-rich sources, I calculate I'm getting 105. So just from my diet, I'm getting a lot. I'm getting 800, 900, probably close to a gram per day just from my diet. That's something I've done for a lot of years. I also bee pollen. I have 1 or 2, 3 tablespoons of bee pollen on a daily basis. And bee pollen is really rich in flavonoids. So I didn't even put that up here. So I get a lot of flavonoids. And I also take a lot of supplements that have flavonoids. And these are the key ones. I'm taking a variety of different types of flavonoids. And I take a product called Vein Sense because I have some vein issues. Had them for a lot of years, but very manageable here. Diosmin is a great vein product, and I take Natural Factors Vein Sense. It has some other compounds in there too. So I'm getting, so I got a gram here, and then I'm getting, there's another gram, there's another gram. So I'm getting about 3 grams of flavonoids daily. That's what I do, and my C-reactive protein is negligible. It's just non-existent. I don't have any aches and pains really. I'm doing great, and I hope to continue that for a long time. I think one of the most economical general flavonoid-rich extracts is grape seed extract. It's better priced than pine bark, very similar in composition. Look at the clinical application. All of these clinical applications have been shown to be benefited by grapeseed extract or pine bark in double-blind placebo-controlled studies. I highlighted hypertension here because 300 milligrams per day of grapeseed extract in mild to moderate hypertension has resolved the hypertension in most of the subjects. Very simple, very economical treatment. Again, the flavonoids that helps those endothelial cells, you get nitric oxide, you get better elasticity, and you get that artery functioning better. They're like hoses. They become less stiff. That improves blood pressure. Asthma, male infertility, menopause, osteoarthritis, periodontal disease, vein disorders, visual function, psoriasis. Great general supplement. I think everybody should take a high potency multiple, extra vitamin D, fish oils, and some sort of flavonoid-rich extract. Grapeseed extract is a great choice. Quercetin consistently demonstrates the greatest activity for flavonoids, primary action, anti-allergy, anti-inflammatory, anti-cancer properties. It's a good choice if you're dealing with any sort of allergy. And it does have this effect on enhancing physical performance. So if you're an athlete, instead of maybe taking grapeseed extract, I would recommend quercetin. It has a multiple effect action on the allergic response. It's different than a Claritin or an antihistamine. Those compounds, the way they work is we have receptor sites on our allergy cells for histamine, and so what happens is these compounds block that site, and as a result, they will block the action of histamine. But the problem is the feedback is that to the cells that make the histamine is, oh, I need to make more histamine. In contrast, the way in which quercetin works is it actually inhibits the formation and release of histamine. So we know that with antihistamines, they start losing their effect. So you have to keep taking an escalated dose until finally they're not very effective. With quercetin, it avoids that, and we have good data with that. One of the problems with some of the flavonoids, like curcumin as well, is poor bioavailability. There are a couple of forms of quercetin that have been developed that have great bioavailability. EMIQ, quercetin phytosome, and quercetin lipomycel matrix. These are all advanced forms of quercetin. I like the latter two especially. This is looking at this is a study that looked at quercetin powder versus quercetin phytosome versus quercetin lipomycel matrix, and the quercetin lipomycel matrix and the quercetin phytosome. These are much better absorbed than regular quercetin. So they would be my recommendations if you're going to use quercetin. The lipomycel matrix is made by, it's a nano emulsion with medium chain triglycerides, basically coconut oil, and that leads to better absorption. I kind of just wanted to make sure we had a few minutes to answer some of your questions. I've given you a lot of information. I want to refer you to my website and also my book, The Magic of Food, for follow-up. And more than anything, I just wanted to inspire you. Hopefully you can tell from my enthusiasm and joy from talking about these compounds that it's fun for me. For me, the biggest thing I notice when I learn about these food components is that it fills me with a sense of awe and appreciation for nature. And those feelings, those fuel, that's like, it's almost like a positive addiction. So I'm trying to get you addicted to learning about these food components, because I think it'll lead you to enjoy consuming the foods that contain them even more. So do we have any questions?
First, I just want to thank you real quickly, Doctor. That was very informative, and I definitely feel the infectiousness of your excitement for the subject. So, real quickly, I just want to go over a couple quick things for our audience regarding the Q&A. We don't take any questions directly from the chat. We just ask people raise their hands. If you don't know how to raise your hand in Zoom, you're going to just need to go to the reactions button second from the right and click on raise hand from the menu that pops up. When I call on you, just state where you're from and ask your question. And we just ask that questions are brief and on topic. And we're going to go ahead. I see a couple hands raised, and we're going to go ahead with Alice. Alice, where are you from and what's your question?
California. I have a question about the cocoa. What's the best product that's not high in sugar? Like, can you drink it like hot chocolate, but not have high sugar, or something that tastes good?
Yeah, I have a secret. I use raw cacao, and then I mix it with allulose and stevia. These are natural sweeteners, and you can buy the raw cacao powder and mix it in with some almond milk in a hand mixer, and you got yourself either a hot or a cold cocoa. So it's very economical. It's a great way to gain the benefit, and also I think it tastes great. I've written about it, and I talk about it. I call it my brew. I have a big mug of it, especially in the winter. In the summer in Arizona, I generally have it cold, and like I said, you kind of get addicted to some of these foods, and chocolate is one that it's easy for us to get addicted. I do want to answer one question on from the chat. It was about grapeseed extract. The extract is a polyphenol-rich extract, so it doesn't have any oil. The questioner was right about you want to avoid grapeseed oil because it's an omega-6 oil, but in the grapeseed extract, there's no oil. It's all polyphenols. It's all flavonoids.
Great. Thank you for that.
And what is allulose?
Allulose is a non-caloric, it's low caloric sweetener. It's about 10% as sweet as sugar, but tastes about 80% as sweet. And it's really the holy grail of natural sweeteners, because it actually is good for you and has actually been shown to promote weight loss.
Great. I got a question for you. Aside from diet and nutritional supplements, what are the most effective things we can do to prevent health?
To prevent health or promote health?
To prevent disease. I'm so sorry about that. Prevent disease.
Yeah, well, I think it's it's kind of like the blind men and the elephant. You ask, what's an elephant? And when you talk about what is health and what's important, we have to have a positive mental attitude. We have to have a health promoting diet, health promoting lifestyle. And then we can benefit from bolstering our health from supplementary measures, whether it's dietary supplements or body work or chiropractic care or whatever. But I think I had a patient once, and I loved this patient so much. His name was Dean, and he had a very rare genetic disorder, and he was the longest lived person in history with this disorder, and no one had ever worked harder at being healthy than he did. And it was heartbreaking to see, but he inspired me, and he said something that I'll never forget. I asked him once, what was the sense of it all, because he was living a very painful existence, and he says, all I can do is all I can do. So why wouldn't I do all that I can do? And, so many of us, we take our health for granted until it's gone. I do everything, and I do everything. I have lots of leverage to be healthy. I know what it's like for a child to lose a parent. So I want to delay that as long as possible for my children. I know what it's like to not feel good. I want to feel great. I don't want to be a burden. I still want to contribute to the lives of those people that I'm connected to and love, and try to make my life a positive vehicle. So, I create a lot of leverage in my book, The Longevity Matrix. The most important step in that book is the kind of the first exercise I give people, and that's creating a why. Because what I realize in talking to people about living longer is a lot of people don't really want to live longer because they're not enjoying life. They're in pain, they're depressed, they're suffering, they're not living life as it's meant to be lived. And so, and helping them realize that they have the ability to create reasons to live, and that I think that's where it starts. You have to have that reason. And I could tell stories after stories from patients that defied the odds with very poor prognoses. They lived because they had such powerful wills and powerful reasons to live. So if I had to say what's the biggest step is choose wisely and make health a priority by looking at all the reasons that are important to being healthy.
Great. That's very profound. Thank you. And what health issues respond better to mainstream medicine versus natural? And what health issues respond better to natural approaches as opposed to mainstream?
Anything in regards to what conventional medicine does well, anything that requires a heroic measure. You get shot in the chest, you get in a car wreck, you break your leg, you need surgery. Medicine, conventional medicine is great. What conventional medicine fails is in the gray area of health, and just poor function, not a disease per se, as well as in chronic disease. I think it's just it's crazy. Most of the conventional drugs, if you look at the way they work, they end up causing more problems than help. So I think that in chronic degenerative diseases, depression, cardiovascular disease, arthritis, insomnia, it goes on and on and on. I just think that nature has better answers, and these natural answers often work best when they're part of a truly holistic approach: diet, lifestyle, attitude. So, do everything you can and choose health.
Great, thank you. And I'm going to take another question from the audience. Monty, what's your question, and where are you from?
I'm from Trenton, Ontario. I grew up in Jamaica, and I saw a lot of local berries that are not mentioned in, the prominent books, like what you would see blueberry, raspberry. What do you think about those berries? Consuming those berries, as long as they don't harm, do you think they have the potential for this large amount of flavonoids as well, apart from the ones that we know, the conventional blue, raspberry? Yeah.
Generally, any darkly colored fruit is really high in flavonoids. So that's the intensity of the color is really the key factor.
Okay, I had quite a number of them, so I was hope I got.
Oh
some
yeah, I
benefit.
mean, when you travel the world and you have we have such a not the full range of possibilities in North American supermarkets. When you travel the world, you see they have all sorts of interesting and beautiful fruit. So yeah, take advantage of it when you're in Jamaica.
And Doctor, do you mind if we take one more question from the audience?
Sure. Yeah, one more.
All right, great. Sophia, where are you from and what's your question?
Thank you so much for taking my question. Thank you so much, Doctor, for this great presentation. My question, please, is aside from a healthy diet, is there anything that would help with synovial inflammation? And second question is how to mitigate side effects of heavy metals in chocolates.
What in chocolate?
Chocolates studies came out recently that chocolate contains a lot of heavy metals.
Yeah, I think for your first question, as far as reducing inflammation, there's a lot of natural anti-inflammatories, and we've been focusing on flavonoids. But I like enzyme therapy for tendons and synovial fluid, and so I like proteolytic enzymes like bromelain from pineapple would be a good one. In terms of the heavy metal content of cacao in chocolate, some variants have lower levels. Generally, if you stay away from West African sourced cacao, you have lower heavy metals than you would if you had West African cacao. So that would be one recommendation. You can also take there are a number of companies that offer flavanol-rich extracts, and as I said earlier, the grapeseed extract provides similar compounds, and they're pure and they're free of heavy metals.
Great. Thank you so much, Doctor.
Okay.
And Dr. Murray, we would like to thank you. So if we can unmute the audience, please.
Thank you.
Thank you, Dr. Murray.
Beautiful.
Everyone.